Testosterone injections are typically administered either intramuscularly or subcutaneously. You'll hear these referred to as IM or sub-Q, and it just refers to whether the injection is in the muscle or in the fatty tissue beneath the skin. The absorption of the medication is essentially the same. So really, for most patients, they just need to be in an area where they can get that deep enough to be either in the muscle or deep in the subcutaneous tissue, and then the medicine will be absorbed very well. If it's done too close to the skin with a larger amount of medication, sometimes that can cause a whelp or a skin reaction, but these are very well tolerated for most patients. So we're going to demonstrate techniques in a couple of areas of where these injections can be administered. For injection in the shoulder or deltoid muscle, always remember that you're trying to be in the muscle or possibly in the subcutaneous tissue right above it. Don't Google shoulder injection and give yourself a subacromial injection like your orthopedist might do for bursitis or impingement syndrome. We're trying to be in the muscle with this injection, but this is a very common area that's easily accessible for most patients. For a shoulder injection, you generally want to find the bony prominence of the shoulder, this is the acromion, and be at least 2 fingers below that, so down here. Remember, we're not trying to be anywhere near the shoulder joint. We want to be in the body of this muscle right here, the deltoid. So come down at least to here, and let's hit this fleshy part of it right here. As always, we'll clean the skin with an alcohol wipe. Again, I've located this area where I want to give the injection. We're going to clean that all around. We have our pre-drawn injection. This is 1/2 milliliter or 100 cc's of testosterone. And in this case, we're using the small 27 gauge needle. So once that's removed, the area that we cleaned is identified. You want to be perpendicular to the skin. Don't go real slow and just kind of drag it in. You just want to pop that in right there. Very comfortable with the 27. You almost don't feel that. And then slowly inject that. Again, with a smaller needle, kind of like drawing it up, it will take a couple of seconds to inject that. You may get a little bit of blood or a little bit of oil that comes out at the site. That is not a problem. Just hold a little pressure with gauze or an alcohol wipe. So when I withdraw it, not much right there. And that's how the injection is given in the shoulder.